In this video lecture, we're going to get into some anatomical terminology. Now, why do we need to learn anatomical terminology? Well, just like anything that's very complex, there needs to be kind of a standard so when people are trying to communicate, we know what we're talking about. The human body is in 3 dimensions with layers upon layers of tissues and components. So when you're trying to explain where something is, and if you're in the medical profession, you need to be very specific with conditions, right? So for example, if a doctor reads a chart, they need to know exactly where and what the issue is. And if the terminology isn't on point, somebody can make a terrible mistake. So anatomical terminology is an important thing to learn if you're going into the medical profession, and just if you want to be able to talk about the human body in a way that everybody can understand. So let's get started here. First off, anatomical position. So there's a starting point. So whenever I describe something to you in the human body, we're always talking about it from what's called the anatomical position. So let's talk about what that means. It's pretty simple. Anytime we use anatomical terminology, we're always going to assume the body is in this position. Standing up, facing forwards, arms at sides, and then palms facing forward. Now, that might be like, well, who cares? What's the big deal? Well, think of it this way. Let's say I wanted to give you directions on how to get to my house, right? And I give you directions from your house. So I say you turn left here, you hit the Wawa, you make a right, and I'm using all just, landmarks. And then I try to give you those same directions from somebody else's house. It's not going to work, right? If it's from your house to get to my house, those directions work great. But if we start from a different point, I can't use those same directions. So anytime I'm explaining where something is on the body, it's very important that the person is in anatomical position when we're talking about where they are. So for example, if I have my arms at my sides and I say it's above my wrist, well, now if I have my arm above my head, that same thing is below my wrist. So depending on where you're standing and what you're looking at, it has an impact. So just know anatomical position is standing, facing forward, arms out sides at the sides, and then palms facing forward. So anytime I talk about any of this in the next couple slides, we're assuming that the patient or the person is in that anatomical position. Now we have to go through some terminology here. So I'm going to run through these, and this is challenging, but you'll get the hang of it relatively quickly. So this is called relative position. So basically what we're doing is we're not saying where something is, we're saying where it is in relation to something else. So it goes right back to my example of giving directions. I might say, if you're trying to get to my house, I might say, oh, when you hit the Wawa, you go 3 more blocks, you turn a left, and then it's 2 houses past, this bridge, something along those lines. I'm using landmarks to tell you where to go, instead of just giving you an address. Because if I just give you an address, that's not going to help you very much if you don't know where it is. So these are all examples of that. We're talking about describing one part of the body in relation to another. So I'm going to run through these, and that'll be it for this. And we're going to go over some practice in the questions for this lecture. So the first one would be superior versus inferior. So if you take a look at this diagram here, the human body is really broken into 2 components. The axial skeleton, which is composed of the trunk, which is the head, the torso, right, the thorax and the abdomen. That's going to be what's called the axial skeleton. And then the appendicular skeleton is going to be the arms and the legs. Now, why is that important? Well, the reason why that's important is because the arms and legs can change their position and the trunk and head cannot, right? So we'll talk about why that's important. So this first one here, superior versus inferior, refers only to the trunk. So what does that mean? Superior means above, inferior means below. So for example, I would say my nose is superior to my mouth. My mouth is inferior to my ears. So it's one versus the other. Now I can't use that same terminology for my arms and legs, because let's go back to my anatomical position scenario. If I put my arm down at my side, I can say my wrist is inferior to my elbow. But as soon as I put my arm above my head, well, now my wrist is superior to my elbow. So it doesn't work for your arms and for your legs. So superior and inferior only refers to the trunk and head. So for example, my hips are inferior to my shoulders. Okay, so that's superior versus inferior. We don't talk about that with the arms and legs. Anterior versus posterior, same thing. It's going to be for the trunk. So for example, anterior and posterior, and sometimes for the arms and legs actually. Anterior means front, posterior means back. So for example, my nose is anterior to my ears because they're towards the front of my head, posterior is in the back. Or I could say My shoulder blade is posterior to my sternum, which is the middle of my chest. So it's in front or in back. So in terms of those. Medial versus lateral. Now this is one that tends to throw people off. Imagine a line going right down the center of your head. So if you look at my diagram here, you can see there's a line. It's called the midline of the body. We are, for the most part, we're symmetrical. If it's on the right, it's on the left. There's only a couple things that only exist on one side. Everything else, we're very symmetrical. So that median line is the dividing line of the body. The closer you are to that middle is going to be medial. The farther away from that midline is going to be lateral. This does not count for the arms and the legs. Again, this is just the midline because my arm can change. So I'll give you an example of that. So, for example, my shoulder is lateral to my sternum. My nose is medial to my ears. My eyes are lateral to my mouth. So it's farther away from or closer to that midline. Now, why can't I say that my hand is lateral to my hip? Okay, well, the reason why is because what if my hand moves inward? So like, for example, if I have my hand out to the side, it's lateral. But if I move my arm like this, well, now it's medial. So we're only talking about the trunk when we're talking about medial versus lateral. Now, this next one deals with the appendages, and that's distal versus proximal. Distal, think distance or far away. Proximal, think proximity. This is one that always throws everybody off. Now, it only refers to the arms and to the legs, to the appendages. For example, my wrist is distal to my elbow because it's farther away. So we're talking about how far away is it from the trunk. So if the shoulder's here, which is farther, my fingertips or my elbow? Well, that means my fingertips are distal to my elbow, or I can say my elbow is proximal to my fingertips. So this does get a little bit confusing, but once you get the hang of it, it's actually very easy. You just have to make sure you understand these terms. For example, my knee is proximal to my foot because it's closer to the hip, right? Or I can say my shoulder is proximal to my elbow because it's closer than the elbow is to the trunk. So just to review this slide, superior versus inferior, it deals with the axial skeleton and it's above and below. So my shoulder is superior to my hip. Anterior versus posterior is front versus back. So that means my front would be anterior, my chest would be anterior to my shoulder blades. Medial versus lateral is farther or closer to that midline. So my sternum is medial to my scapula, which is my shoulder blade. My hip bone is lateral to my abdominal muscles. And then finally, distal versus proximal is how far away we are from the actual body, the actual axial skeleton. So for example, my wrist is distal to my elbow and my elbow is proximal to my fingertips. Let's finish this up. The next one is contralateral versus ipsilateral. So I'm going to just draw a little line here, maybe. Maybe not. Okay, so there's a line. Imagine a line right down the center here, a midline. Contralateral versus ipsilateral means on the same side or on the opposite side. Contra means oppose, right? So contralateral would be the liver is contralateral to the stomach because it's on the opposite side of the midline. Ipsilateral means on the same side. So my liver is ipsilateral to my colon. So I could say my right shoulder is ipsilateral to my right hip, but my right shoulder is contralateral to my left shoulder. And then the last two are pretty straightforward, deep versus superficial. Superficial means closer to the skin or the surface. Deep means closer to the middle of the body. So for example, my skin is superficial to my muscle layer, but my muscle layer is deep to my skin. I could say my stomach is deep to my abdominal muscles because it's deep to it. And then finally, peripheral just means to the outside. So the peripheral really doesn't belong on this list in a sense because it's not relative. Peripheral just means to the outside. So think of peripheral vision. So if you want to know what your peripheral vision is, you just take your finger, look forward, and then just keep moving your finger to the side. Don't move your eyes. And wherever you can't see your finger anymore, that's the limit of your peripheral vision. So peripheral just means to the outside. So I would say like my peripheral nerves are farther away from my spine. Okay, and lastly, last thing is going to be our body section. So it's how we cut the body. And I'm just going to go through these quickly. It's just knowing terminology. You need to know both of these terms. So if I want to cut the body into a right or left side, so cutting down the middle into a right or left side, that is called the sagittal or median plane. If I want to cut the body into an up or down, top or bottom, okay, that's going to be that superior, inferior. That's going to be called transverse or horizontal plane. And then finally, if I want to cut the body into what would be anterior and posterior, front and back, if we're cutting this way, that would be called the coronal or frontal plane. So one thing just to make sure you understand, it doesn't have to be exactly in the middle. I can have a sagittal plane. So for example, if I were to remove this person's arm to study it, if it was a cadaver, I would make a sagittal cut to remove the arm so I could see the structure of the shoulder. If I do the same thing here, if I wanted to remove the top of the head here to see the brain, cavity, I could do a transverse or horizontal plane, and the same thing for coronal. Thank you very much.